A very warm welcome to everyone joining the Toileting and Fragile X Across the Lifespan webinar part 2 with Dr. Jennifer Epstein. So I know in Australia it's customary to begin with an acknowledgement to country. So I'd like to acknowledge in Aotearoa, New Zealand, we recognise Māori as tangata whenua, the first people of Aotearoa, New Zealand, and the Treaty of Waitangi as our founding partnership document between Māori and European settlers. So my name is Andrea Lee. I work as the Executive Director for Fragile X New Zealand, and I'm also the mother of a 19-year-old son with Fragile X syndrome. So again, it's my pleasure to be partnering with Fragile X Association of Australia for this webinar. So part 2 of the toileting series is focused on children aged 10 and older and adults with Fragile X syndrome who may need support with toileting skills either on an ongoing basis or from time to time as issues arise. So toileting is often an issue for us as families, and we know that toileting skills take more time for our family members to gain skills and master. So as families and parents, it can feel overwhelming, particularly as our children become older and toileting issues persist or re-emerge. We know it's often challenging to find relevant information and support for older children or adults, and we can feel isolated. And I know I've often felt alone in this toileting journey. So it's wonderful to have this opportunity to hear from a specialist in both Fragile X and toileting, and to consider ideas and strategies to support good outcomes. So a reminder too that part 1 is available online so that you can be reminded about some of the foundation skills and considerations for toileting through a Fragile X lens. Well, it's my great pleasure to welcome Dr. Jennifer Epstein. We are so fortunate to benefit from her immense knowledge and experience working with individuals and families affected by Fragile X syndrome. So Dr. Epstein is a licensed clinical psychologist with more than 25 years experience working with children and families. She completed her doctorate degree in clinical psychology from Wright State University in 1994, and has completed a 2-year postdoctorate fellowship in developmental disabilities and clinical psychology at JFK Center for Developmental Disabilities at University of Colorado. Dr. Epstein specializes in treatment of neurodevelopmental disorders such as Fragile X syndrome. She is a certified Early Start Denver model trainer, and Dr. Epstein's clinical services are currently delivered in home or community settings or via telehealth, where she works with children and families. She has lectured nationally and internationally on the topic of Fragile X syndrome. Previously, Dr. Epstein worked at the University of Colorado at Denver, where she provided diagnostic assessments for the Child Development Unit and the Fragile X Treatment and Research Center at Colorado's Children's Hospital. Dr. Jennifer Epstein is in demand as a speaker and a trainer of other clinicians. So we are very grateful she has made time for us to be with us today and to share her knowledge about this important topic. So over to you, Jennifer.
Good morning. My name is Dr. Jennifer Epstein, and I am here today to talk with you about toileting and Fragile X syndrome, strategies and supports across the lifespan, Part B. 2 weeks ago, I provided a workshop which focused on the needs of younger individuals under the age of 10. And in today's workshop, we'll be providing information about individuals who are ages 10 and older. And of course, that's a wide range of ages, but I will be individualizing some of the strategies as we go through the material. So I'm so glad you can join us today. I want to begin by thanking the hosts of this webinar series. I want to thank Andrea Lee of Fragile X New Zealand and Wendy Bruce of Fragile X Association of Australia. And of course, I also want to thank the families that have shared their journeys with me. I learn from families every day, and I feel so lucky to be able to pass on the information to help others. In today's workshop, we'll be reviewing Fragile X syndrome, autism, and toileting patterns. We'll be discussing ways to set the stage for progress. We'll review scheduled training and scheduled toileting in terms of approaches. We'll troubleshoot incontinence issues and bowel issues, as well as discuss community strategies. And finally, we'll end with an opportunity for questions and a wrap up. So let's get started with today's material. I want to begin by discussing a little bit of information from the Forward Project data. In my last workshop, I went into greater detail, but today what's important to focus on is the results of some of the preliminary information. This research came from Dr. Elizabeth Berry Kravitz and the Scientific Advisory Committee of the National Fragile X Foundation when they provided an opportunity for families to provide information about their experiences. Today's information that I'm reviewing was based on approximately 600 or more individuals, many of whom were males, but some of whom were females as well. And in this information, with regard to toileting, what we found was that individuals toilet trained overall later, with most girls achieving toilet training by age 6. And many individuals with Fragile X, boys included, achieving some toileting skills by age 10. But additionally, we found that progress continued, and by age 15, more individuals had achieved toileting skills, and by age 20, even more had attained toileting skills. There are some, however, who do not reach full toileting skills during their lifetime. And so in today's workshop, I want to talk about all of these different aspects and possibilities for toileting development. One of the things that's very clear from the information is that we really need to individualize our approach to toilet training. It is really important to set realistic goals. And so we don't want to assume that we need to start super early on toileting training, but we also want to continue to leave the door open for hope in that if your child is 10 and they are not toilet trained, it does not mean that no progress is possible. We cannot assume that all individuals will benefit from the same strategies. And so in today's workshop, we will continue to make different accommodations depending on the individual and the neurobiology of Fragile X. Additionally, I want to mention that one of the outcomes of the research is the idea that the presence of autism spectrum disorder as an additional diagnosis to Fragile X, as well as level of cognitive impairment and irritability, can also additionally make it difficult for toilet training. So we will include ideas about those aspects as well. Now, it's important to consider the neurobiology of Fragile X and what we know about Fragile X when we're setting the stage for toileting progress. So what do I mean by that? I mean, we need to continue to individualize accommodations based on what we know about having Fragile X. So we know that there are physical issues. We know that individuals with Fragile X have motor planning issues and that this can affect skills. For example, pulling pants up and down, getting to a bathroom, being able to sit and feel comfortable holding one's body on a toilet. Sometimes these issues can be affected by, for example, gravitational insecurity. And so it may be really helpful to have a footrest in place, both to help the person feel steady on the toilet, as well as for being in the proper positioning for voiding. There are other issues that come along for individuals with Fragile X that can relate to stool consistency. So it's important to consider treating constipation issues or loose stools if those are a problem, possibly adjusting the diet or seeking assistance from a GP. It's also important to pay attention to the sensory aspects of the bathroom. Is the lighting too bright or too dim? Are there heavy scents? Do you like to use potpourri or air freshener? That might make the bathroom nicer for you, but it might be overwhelming for someone who has a lot of sensory stimulation. And so it's important to pay attention to those considerations. We want to think about dressing for success for toileting. If you're at the beginning of the toileting journey, it may be important to consider having clothes that are easy on and easy off if the focus is on an individual being more independent in their toileting skills. For other individuals, if we're talking about longer term nappy use or disposable underwear, it may be important to not have clothes that are easy on, easy off, because we may be trying to use clothing as a means of preventing reaching hands into the pants to decrease the possibility of poop smearing. These are just some of the things that we want to think about when we're setting the stage for toileting progress. Additionally, it's really important for us to consider ways to accommodate the communication delays and impairments that can go along with having Fragile X syndrome. We want to use simple, consistent language paired with gestures. And we also want to make sure that we have visual strategies in place, such as this bathroom icon, which shows a picture of a toilet. This would be something that an individual could point to show that they have the need to use the toilet. We compare a picture, whether it's a line drawing like this one, or a photograph, or an object such as a roll of toilet paper or a nappy. Those are all objects that could be used to help an individual understand that it's time to walk toward the bathroom if we need to practice sitting on the toilet or if we're going to do a nappy change. Lastly, on this slide, I also mentioned social stories, which are also very important. Social stories is an approach where we're teaching opportunities to learn greater social understanding through the presentation of pictures with simple words that tell a story. So we can have a story that focuses on practicing using the toilet, or we might have a social story that focuses on how to ask for help when you're in the community, how to locate a bathroom, how to manage an accident if you've had an accident while you're out in the community. So there are a lot of ways that social stories can really be of assistance in setting the stage for additional toileting progress and allowing opportunities for rehearsal. Here is an example of a visual that can be used for a toileting sequence. This particular one I created for an individual who just had a few skills that she needed to be reminded of. You'll notice that I've individualized it so that this one is for a female. She needed a way of us showing her that it was time to walk to the bathroom and then to sit on the toilet, to remember to wipe and to flush, and then to wash her hands. Here is a different toileting visual schedule that provides a little bit more information for someone who needs more support. This one is individualized for use with a boy, and it shows the steps he needs to remember to do, including pulling his pants down, sitting on the toilet, doing wheeze or poos, getting toilet paper, wiping, pulling up his pants, flushing the toilet, and then washing his hands. And you can see that on this one, I've also included the steps to washing hands because he needed additional support with the motor sequence involved in getting clean hands. Now I want to talk for a minute about keeping a toilet log. And in my last presentation, I went into more detail, but I'll keep this a little bit shorter. A toileting log is really helpful for gathering information about the toileting process. For example, it's really important for gathering information about how often someone is wet and what is the relationship between eating and drinking and when they need to go to the bathroom. This information can be used to help predict when a toilet trip will be successful. And this allows us to really set the stage for greater success. So in this particular log, where I've made just a snippet of information, you can see that at noon, this individual had a food and drink break, and their pants were dry and they were not soiled. And you can see about a half hour later, they were wet in their pants. And about an hour after that, they had another drink, but they were still dry. And then at 2 o'clock, which was 30 minutes after they had that drink, they were wet again. So from this information, we can see that this individual has a pattern where they're needing to wee about 30 minutes after they've had a drink, but that they can hold their bladder for about 90 minutes, at least at this time of day. You know, the pattern can change at different times of the day, and this is why we suggest gathering the information. Keeping a log is a good idea if you, for example, are just starting this process, or maybe your child is 10 or 15 and you've taken a break from actively working on toileting, but you're ready to get back at it, but you're not really sure how often your family member is using the bathroom and needs to be changed. Because let's face it, current modern nappies are super absorbent, and we may not know when our person is gone immediately, because it takes a while for us to notice that their diaper or nappy is sagging a little bit. Okay, so we want to talk a little bit about toileting on a schedule. And this is when you're going to take the person at regular intervals to help them go to the bathroom and stay dry and clean. The log data is going to help guide successful times to practice sitting. And this allows the individual to learn to wee or poo on the toilet when they're on the toilet. The goal here is not necessarily to teach independence in initiating a trip to the bathroom. That's great if it happens, but lots of individuals I know with Fragile X live beautiful lives simply going to the toilet when they're reminded that it's time to go. And that's a really helpful thing in terms of quality of life for individuals who can achieve this. So we want to make sure that we have a way of reminding them. And we want to individualize the reminders so that it fits, again, the individual. So some people are going to be on a visual schedule, maybe one that uses picture icons that are Velcroed to a board, and they move them into folders when they've completed the activity. And if that's the kind of schedule an individual is on, then we might simply add a picture of a toilet or a bathroom at regular intervals, maybe every 90 minutes or every 2 hours, depending again on the frequency that they're going to need to use the toilet based on the log data. Other individuals are going to be on their iPhones or their other phones, Android phones, and they may use a reminder on their phone, an alarm that will go off at regular intervals that will mean time to go to the bathroom. And modern phones are so great, they can have different ringer tones so that the alarm might sound differently if it's cueing them to go to the bathroom than if someone is sending a text or a phone call. Other individuals are going to do best with just a general social verbal reminder. Hey, it's break time. I'm going to go to the bathroom. Want to come? Let's go to the bathroom. So again, remember to individualize your reminder as you're thinking about toileting on a schedule. The log is going to guide you to know some key important information. How often does the individual wee, and how long can they hold their urine? Do they go more often during certain times of the day, sometimes morning or frequent time for lots of toilet breaks? How often are there BMs? Is there a consistent time of day or pattern? Do they go once or multiple times in a day? Other people only go once every few days. It's really important to gather that information. And it's also important that as you change the individual each time they're wet or soiled, you use the words either, oh, you're wet, let's change, or oh, you're soiled, let's get a clean nappy, or great, you're dry if you're checking them and they're dry. So just pairing that simple information verbally can be really helpful for creating consistent cues. Now, in scheduled training, we're going to use this log data to determine the interval for how often to take trips to the toilet. The individual is going to sit on the toilet for 2 to 5 minutes. If he or she voids, then give them praise. Some individuals might need more time for a BM. So if you know that the individual you're helping tends to go move their bowels maybe 7:35 a.m. Some people are like clockwork. If that's the case and it's 7:32 and you get get them to the bathroom, you might wait a little bit to give them a chance to actually have a bowel movement. If nothing happens, then you're going to give them a break from the bathroom. But first, make sure they finish the routine, because we're also trying to teach the routine here. So we want to give them an opportunity to practice finishing pulling their pants up, flushing the toilet, and washing their hands. Bring them back to the toilet again in about 30 minutes to try again if they're still dry. You can keep a shorter schedule until they have success or until an accident occurs, and then you can resume regular checks. Now, you're going to use the toilet log data to guide the individualized timeframes. If you know from your log data that the person only has a wee about every 2.5 hours, then once you've taken about a week's worth of data, you don't need to keep taking them every hour. That wouldn't make sense. They're going to be practicing doing nothing. But you do want to try and use the log data to guide you in determining how often to take them so that it's successful, but so that nobody gets too frustrated. This is a general approach that will shape the use of the toilet for urine and BMs. Now, you might be wondering, how am I going to get Johnny to stay in the bathroom for that length of time? And there's lots of ways to help with that. You can have materials in the bathroom that you give them to occupy them while they're on the toilet. For example, you can have interesting books, fidget toys, but you can also try using a visual timer. And in this visual timer, I'm going to show you how it works. This allows the individual both to see time as it goes by, as well providing something interesting to look at when they get reinforced for sitting for so long. So I have this timer set for 10 seconds, but you can individualize it with whatever time frame you need. And you can also individualize the pictures that will be displayed based on the person's interest. And I have information about this particular app, which is available both as a free version that has commercials and a paid version. The information for that is available on the resources page. So let's show this. So if you're a fan of tigers, then that's a pretty exciting thing. If you're not a fan of tigers, that would not necessarily be a motivator. So again, you want to individualize your approach. Okay, so let's talk a little bit more about scheduled toileting and who this is a fit for. So some individuals are successful when they are seated on the toilet, they eliminate. And if that's the individual that you're working with, scheduled toileting is a great approach to use. Some individuals used to use the toilet independently, but for whatever reason, they're now having accidents. And if that's the issue, then this is also a good approach for beginning to troubleshoot the time frame and beginning to build back in success. Some individuals, they cannot identify when they need to go to the bathroom. Sometimes they're right in their prediction and sometimes they miss the window, but they do go when they're taken. So this would be a good approach for them. Some people know when they need to go, but they can't get to the toilet on time. Once they have that urge to go, it's almost immediate. So scheduled toileting might be a good approach for someone like that. Other individuals are just inconsistent. They're inconsistent in being able to attend to their internal cues. They often get distracted, or maybe they struggle with telling time, and so they're not sure when they last went. And scheduled toileting might be good for them too. Remember, you can add a picture of a toilet or a bathroom sign to a daily visual schedule to help the individual know when they should take a bathroom break. I want to make the comment that life can be messy. Boy, hopefully we all know that. It's really important to be prepared and calm and to provide supports to minimize the impact of an event such as an accident. Try not to show strong emotion like yelling or reprimanding or long discussions or lectures. This won't help, and it actually will end up making you and the other person feel worse. So whatever you do, try to keep it positive. And if there's a way to manage to include humor in this, maybe some potty humor, I would recommend keeping it light and funny. Now I want to talk about troubleshooting incontinence and to go into a little bit more detail. We're going to use the log for patterns. We're going to be like detectives as we really study the pattern between when people eat and drink and what they're eating and drinking and when they're voiding. Some foods and drinks can cause more frequent urination. Some foods like citrus, orange juice, oranges, lemons, limes, for some people can cause more frequent urination. Alcohol, caffeine, such as coffee and teas, energy drinks, carbonation, such as seltzer water or water with gas, those things can also cause more frequent urination. In terms of educating us, the average bladder is full after about 2 cups of fluid, and typically this occurs every 2 to 4 hours on average. But of course, people have different styles and patterns and habits. So some people tend to drink a lot in the morning. They might have a couple of cups of coffee, and then they think, oh, I should be drinking water. So they drink a lot of water, and then they need to wee a lot in the morning. Other people may have jobs or activities that make it harder to drink continuously or frequently. So some positions may require someone not have accessible drinks if they're working out in the community, if they're in school, etc. And so those individuals may not drink very much during the day, and then when they get out of school or they get home, then they tend to drink a lot in the afternoon or into the evening. And this, of course, means that then they need to wee a lot in the evening, and sometimes this can even affect sleep. So behavioral interventions may help to change drinking patterns if that seems to be important. And so there's a couple different strategies to think about. One is to limit or decrease fluid to about 4 to 6 ounces every hour rather than drinking large quantities several times a day, or to stop drinking 2 or more hours prior to bedtime so that there's less reason to need to wake up and less bedwetting. As you're gathering information about the toileting patterns, you're going to be learning more about what type of incontinence someone might be experiencing. Some people leak with intra-abdominal pressure, so coughing, sneezing, people who leak when they're being tickled, laughing, blowing the nose, if they're exercising, such as reaching or squatting, this type of incontinence can lead to leaking. Other people experience urge incontinence, where their bladder contracts too soon, and suddenly they need to go, and they don't have enough time to get to the bathroom. So some people struggle with that, and that's a different type of incontinence. And then other people struggle with completely emptying their bladder. And so even though they're going to the bathroom and they're using the toilet, because they can't completely empty it, they need to go more frequently, or they have frequent accidents. Another pattern is nighttime incontinence, where people wet the bed at night or need to wake up in the middle of the night and they don't get to the bathroom in time. One thing I want to mention here that's really important is if you're seeing a new pattern, if someone didn't have an incontinence issue and now they do, that's a time when it's really important to consult with a GP or a physician to rule out medical etiology as the cause of what's happening. Signs of suddenly having incontinence can be a sign of a different untreated medical illness, and we wouldn't want to overlook that. So I have a video that I want to show on how to properly empty a bladder. So here's the video. I think that video is so helpful for really showing us things like the proper positioning and giving us some ideas on how to help people if they're struggling in emptying their bladder fully. It's really helpful to think about positioning, and also even the idea of standing up and repositioning as a way of helping them. So thanks for watching that video. And I also have that video information on the resources page. It's also important to note that breath work can help people to learn to engage and relax the pelvic floor muscles. So it can be really helpful to seek additional consultation from a pelvic floor specialist. And this is typically a type of physical therapist who can assess and provide strategies for strengthening the pelvic floor muscles. Now, of course, as women, if you're a woman who's given birth to children, you may be very familiar with the idea of having a weak pelvic floor, which leads to some leaking or voiding issues. But this isn't specific just to women. It can happen to men, and it can happen to people who have low muscle tone, which of course many individuals with Fragile X would fall into that category. And so by meeting and working with a pelvic floor specialist, what you can gain are strategies in how to train the pelvic floor to work better. There are exercises to practice while holding the breath, such as an elevator exercise where you're visualizing an elevator going up as you breathe in, and as it goes down, you're breathing out. And this allows you to practice engaging and relaxing the pelvic floor. There are balloon breathing exercises that are similar, where you're thinking about the balloon inflating as you breathe in, and as you're breathing out, the balloon is deflating. And this can also help you to think about engaging those same muscles and releasing those same muscles. And you can also practice Kegel exercises with a therapy ball. And these are things that a PT can really help guide and write a program that then you can practice with the individual to help them get in greater touch with those muscles and really be able to manage their urine stream more efficiently. Mindfulness and breathing exercises can also help focus attention on body signals and sensations, such as the signal that your bladder is getting full and that you need to use the bathroom. I want to acknowledge Tracy Stackhouse from Developmental Effects for a minute, because not for this particular presentation, but last year when I was working with an individual who was struggling with voiding, with completely voiding when they were on the toilet, I sought out her assistance, and she gave me some suggestions, including showing me the video that I've just showed you. So I want to thank Tracy Stackhouse for her continued ongoing collaboration in helping me work with families who have Fragile X syndrome. Now I want to turn for a minute to talk about troubleshooting bowel training. As I've already mentioned, there can be issues with regularity and stool consistency, and sometimes this is related to diet, but sometimes this is related to the neurobiology of Fragile X. Just some people tend to have loose stool and some people tend to have constipation, just the same way, in the same way that this could happen within neurotypical individuals as well. If someone is struggling with either regularity, stool consistency, it's the long-term constipation, it is important to talk to a GP because constipation can be painful. And when it's painful, then people tend to want to avoid the pain. And so they can actually start to hold their poop in longer, and this creates a vicious cycle where they're holding their poop in and they're becoming more constipated, and it's more painful, and also it stretches out the colon, and in that process it can also affect the sensation of having a full bladder. So if constipation has been something that the individual has been struggling with, it is important to get some medical guidance so that you can do a full clean out of the bowels and really get them pooping regularly before, and I want to say comfortably, before you start working more on bowel training. You can also pay attention to some other factors, like do they have a restrictive diet because of sensory issues? Are they a picky eater? Do they drink enough fluids? Do they get enough fresh fruits and vegetables? Do they get healthy fats? Healthy fats like avocado and coconut oil are really important for being able to produce bowel movements comfortably. So it is really important to think about those factors. I also want to talk for a minute about other patterns that we sometimes see, especially if we're talking about individuals who are adults or who have had long-term nappy use or disposable underwear. If you are working with someone who asks for a pull-up or nappy so that they can have a BM, or you're practicing a toileting approach, and when they're in the bathroom, you've checked, you know it's the time when they should be going to the bathroom, and you sit them on the toilet and they are practicing, but as soon as you put on the nappy, they wee or poo in the nappy. What's happened here is that they've made an association, a learned association, that the place that their wee and poo belongs is a nappy. And that's a different thing to troubleshoot. It's a little bit different from individuals who were catching earlier on in their development and they haven't made those strong associations yet. So I want to mention for a second, on the resource slide, I have Jane Dixon Weber's article, Please Don't Poo-Poo, this article where she really writes about as she was changing her son's pattern from waiting to poo in a nappy. She really used a stepwise approach to changing that pattern so that eventually he was able to poop on the potty. And sometimes we need to use that type of stepwise approach where you're actually first shaping the behavior of having them at least go into the bathroom to wee or to poo in their pull-up, and then beginning to have them sit on the toilet while they're still wearing their pull-up or nappy, so that everything about the situation stays the same, and then we gradually decrease the reliance on the nappy by actually cutting a hole in the back of it over time that gets bigger and bigger till they aren't really wearing the nappy. Sometimes we have to use that type of approach. So I just want to make a comment on that because this is a pattern that we can see with long-term nappy use, which is just, it's okay if you're there. I just want to give you ideas on how to think about beginning to, again, make progress towards shaping toileting in a way that makes more sense. And it is much easier if people, even if they stay reliant on needing a nappy, it's easier if they're using it in the bathroom because that's where cleanup can occur. Now, I want to talk for a minute about wiping and personal hygiene. First of all, wiping is incredibly difficult for individuals who have motor planning problems because you're talking about an awkward motor action. You know, your body position is kind of in an awkward position. You need to reach around and do something that you can't see that you're doing. So it's an invisible motor action, which is hard to do. And that can be really challenging. So I want to make some suggestions about ways to make it a little bit easier as you're working on this skill, because it is an important life skill. You can begin to use hand over hand prompting where your hand is over, so their hand and then your hand, and you can guide them in the motor action that they need to make. But when doing that, it can be really helpful to help get the individual clean first and then let the individual practice the last sweep. So in other words, they've had a BM and then you do most of the wiping and then you help them to do the last swipe. Or the opposite could be true. You let them do the first swipe and then you finish the cleanup. That's really going to depend on individual preference, and also, quite frankly, it's going to depend on the consistency of the BM. It can be messy, and so it may make more sense to have them practice the last sweep and not the first sweep. There are some other suggestions that I want to make, such as wet wipes can be really helpful. For some people, we might want to throw the wet wipes into the trash instead of down the toilet. Even if they say they're flushable, sometimes they can be hard on plumbing. But I also want to, acknowledge the fact that some individuals are not a fan of wet wipes. They don't like the way that feels on their bum to have it be wet. So that may not be a strategy that works. Sometimes wet toilet paper is just as good, and that can be flushed. Other people have told me that just if someone is only pooping once a day and it's at a consistent time and it's at a time when they're home anyway, taking a shower right after they poop is a good plan. Other families really tell me that having a bidet can be quite helpful. And I'm not suggesting that you replumb your whole bathroom, but they do make bidets now that are like an accessory to your toilet that you can add on, that are not terribly complicated. And some families have found that to be really helpful. I think for us, they're available on even Amazon. So it's just another thing to think about. And I promise I'm not trying to plug Amazon, but it's just a suggestion. I do want to also acknowledge the fact that visual schedules can also help introduce this skill with specific steps to teach success. And of course, we're going to continue to individualize the supports based on the individual. Here's an example of a visual schedule that reviews steps that you go through in the bathroom, even including closing the door. That also includes steps for wiping. So if you look at step 4, you pee and poop in the toilet. Step 5, get 1 wipe from the packet. It's very specific. Step 6, you're going to wipe 2 times from front to back. Step 7, put the used wipe in the toilet. And steps 8 through 10 are the typical steps we would have anyway. So again, we can begin to teach and add details about the skills we're teaching in our visual schedules. It's really important, this particular slide is really important to me because much of this workshop has been specifics on teaching toileting use. But I also want to acknowledge the fact that for some individuals, using the toilet is not a goal of our intervention. And that for many individuals, they will be using disposable underwear or nappies or pull-ups across their lifespan. This doesn't mean that we can't continue to work on teaching skills that will make this process easier for the individual and easier for the caregiver or carer. This is especially true for individuals who have learned a pattern that maybe worked, the changing pattern worked for them when they were a child. It was really convenient for them to lie down. Or maybe they had a particular stance that they like to be in for cleaning up, being cleaned up, and it doesn't work because they're getting bigger or you as a caregiver or carer are getting older. And so it's important to know that we can continue to teach new skills as long as we make small adjustments over time as we work on changing a pattern. So kind of you have an idea like a map of where you're starting and where you want to go with a skill. And along the route, there are these little stops along the way, these little steps. And so in creating this new routine, whatever it is, maybe it's that you want a person to stand in a particular place, or you want their hands busy with something so that they're not getting in the way as you're cleaning them up. It may be important to think about what those in-between steps are. And then we're going to use rewards to increase compliance with the new routines, because of course, change is hard. And it's going to take practice and consistency. So making sure that you are using consistent words and that you have the same changing routine across people and environments to help make it be predictable. And you may think about what you need. For example, an individual who's been living at home, but who's going to move to community living, or an individual who's been at home going to school, but is now going to a work setting. You want to have a plan for changes that are going to work in the new setting. So it may be important to take a look at the new setting as you're thinking about your plan. When possible, as I've mentioned, it makes sense to change in the bathroom. So if it's possible to begin to practice that at home, that will make the most sense, because that's the likely place that they'll change when they're in the work setting. We also want to make sure that we're really continuing to teach skills, communication skills, so that the individual can communicate when a change is needed or desired. Asking, are you wet? Do you need a change? Or having a picture system in place, or something on their AAC device where they can request a change or let someone know that they need to use the bathroom. Those are really important. It's also important in thinking about this to consider the use of unitards, onesies, compression pants, overalls, coveralls. You probably have other strategies that you're using that I've not thought of, that can limit the access to a nappy when it's soiled before someone has a chance to get changed. Because anything we can do to reduce fecal smearing is just huge, because it's so overwhelming when that pattern becomes a habit. So I just want to acknowledge this, because this is an important feature for many families to think about, and it wouldn't be a lecture on toileting across the lifespan for Fragile X if we didn't talk about shaping behavior with regard to the use of disposable underwear. Now, I want to talk for a moment about products, and I promise not only do I not get a kickback from Amazon, I don't get a kickback from some of these other products that I'm going to discuss, but I have found that many families have found them to be helpful, so I want to mention them. The Squatty Potty used to have a commercial that had a unicorn that was pretty fun to watch. The Squatty Potty is a footstool. It's plastic, and it wraps around the bottom of the toilet, and it provides a position that allows the knees to actually be above the hips. And this position is really helpful for producing bowel movements. And it's also helpful for pelvic floor placement, for allowing emptying of the bladder. So if the individual is having difficulty with bowel movements or completely voiding their bladder, the Squatty Potty can be helpful. But even if the individual isn't having those specific issues, feeling comfortable when on the toilet, feeling grounded, dealing with the gravitational insecurity issues can be really important. So if it's not a Squatty Potty, at least having a footstool in there that the person can place their feet on if they're on a smaller body. We don't want dangling feet. That's the bottom line. We want someone's feet to comfortably be on the floor. And then if they're having some of those other issues, the Squatty Potty can be helpful. I want to mention Lumi, which is a deodorant that was developed by a gynecologist. Lumi has also really funny commercials. You can tell I like to watch commercials. Lumi is perfectly safe for use on any part of the exterior body. And there are deodorant wipes, there is a body wash, there are deodorant sticks, there are cream deodorants, and there's a deodorant cream that comes in a stick that as you twist it up, it can be rolled on. Lumi, it's very natural. It breaks down. It doesn't have aluminum or some of the other things that can be in deodorants that can be concerning for some individuals. But more importantly, the body wash and using a combination of the body wash and the deodorant allows you to stay odor-free for up to 72 hours. It's great for things like stinky armpits, stinky feet, stinky private part areas. And it comes in a lot of different scents, but they're not an overpowering scent. I mention this just because they've really made a difference in the lives of individuals I've known. But the deodorant wipes are really nice. Also, for example, if you go to the gym and I'm running to the grocery store and I don't have time for a shower, I can use a deodorant wipe and feel fresh and smell okay and go about with my day. Or if you're camping, on airplanes, there's just a lot of times when having something like this can be really helpful. They come in a smaller travel pack or a larger pack, and they can just be thrown in a backpack. I do want to mention, I think it was Lumi. It was one of the wipes I was looking at that said that it was dissolvable and that it was fine for plumbing. It may be fine for plumbing, but I did practice before this workshop, and I put a wipe in a glass of water and I waited 8 hours and it still looked like a wipe. So I don't think it actually dissolves, at least not immediately. But I just want to mention, in full disclosure, I tried it. In terms of other suggestions, it's not so much a product, but an idea. Hanging a picture of a human body in the shower can allow you to teach a sequence for washing the body. And when we're doing the same pattern, maybe starting with the head and going down in a consistent way, allows the individual to learn a pattern, to teach a habit of how to wash the body. Also, families have shared with me that a shower puff, one of those plastic things, or a loofah can be easier than a washcloth in terms of motor planning to help with lathering the soap and washing the body. Now, I want to talk for a minute about community strategies because teaching, I think it's really important for teaching and rehearsing scripts for different events that can happen in the community. For example, teaching individuals how to ask about where is the bathroom? Where is it located? Is it a public restroom? Can I use it? Making sure to teach people how to recognize and differentiate different bathroom signs based on gender, or there's now family bathrooms or unisex bathrooms. It's really important to continue to teach to those things. And so if you're out and about and you see a sign that looks different and it's not the typical sign, mentioning it, talking about it, pointing it out, educating can really help people feel more secure. Also, teaching people how to seek help. It's not really if a toileting accident has occurred, it's more likely when a toileting accident has occurred, because they're going to happen. It's life. And as I mentioned, life can be messy, but we really want to help make people be prepared so that they can go about the rest of their day without it being a devastation should an accident occur. So making sure that if someone has a possibility of having an accident, that they've got a backup pair of clothes, they've got a backup pair of underwear, they've got a backup pair of leggings or pants stashed in a backpack or in the car, in the trunk, if they're with you and you're out and about, with an extra plastic bag for soiled clothes. Helping them have the skills of knowing what to do should it happen once they're out and about, so that they can be as independent as possible. Also, thinking about having and teaching a support plan ahead for situations where a toileting issue is possible and would be consequential. In other words, traveling on an airplane or traveling on a bus or someplace where it may not be easy to get to a bathroom, or you can get to a bathroom, but there's a long line and it's just too long to wait and an accident is going to happen. Or it's a special event, or the individual is going to spend time with unfamiliar people, and so they might not feel comfortable asking, or there's a change in time zone or schedule or regular diet or some other event that could increase the likelihood of having an accident, or a time of high stress, such as a performance. All of those conditions may increase the anxiety around what happens if I have an accident. And once that anxiety around what happens if I have an accident increases, that also increases the likelihood that there will be an accident, because the GI system also can be triggered by anxiety. So we want to help people to feel comfortable, and maybe think about giving them a disposable underwear to wear around their cotton cloth underwear, just in case, because just in case allows someone to feel a little bit more comfortable, and life can be so much better when we have reduced that anxiety. So I just want to talk a little bit about those community strategies. Okay, we're at our resources slide, which means that we're almost to Q&A. And so on this resource slide, there are a few things I haven't mentioned during this workshop. This toilet training for children with special needs is a video that's available on YouTube by Dr. Susan Hepburn. It's a really wonderful developmental approach to teaching toilet training that I think can be really helpful for families. Toileting issues in Fragile X, and Please Don't Poo-Poo This Article, and Toilet Training the Older Child. These are all resources that are available on the National Fragile X Foundation website. This is the paper that Dr. Barry Kravitz and the Scientific Advisory Committee from the National Fragile X Foundation. This is their journal article that really goes into much greater detail about the research that I briefly mentioned upon today. This is the PT video that I showed that shows the positioning for properly emptying the bladder and also the practice of double voiding. And then this visual countdown timer is the timer that I showed on that slide with the tiger that has a lot of different pictures available.
Gosh, thanks, Jennifer. You've shared a lot of information today, and I particularly enjoyed the information reminding us about schedules, routines, the importance of visuals and the community strategies. And thank you for sharing those resources as well. So you've mentioned some products, and just to let everyone know that Loom, the whole body deodorant products that Jennifer mentioned, they are available online in Australia via Amazon, and in New Zealand online via Fish Pond. And also the bathroom stool products